Hi everybody, Dr. Britt Talley Daniel MD, neurologist, headache doctor. Today I'll be talking about a general subject, beginner subject, which is, what is migraine? The International Classification of Headache Disorders, version 3, has two common headache types. They're called primary headaches because they're part of normal human suffering and their cause is uncertain. High blood pressure is also called primary hypertension in the same way. The two primary headache types are tension type headache, which is 70% of headache, and migraine, which is 30% of headache. Less than 1% of all headaches are something else. Most people live with their tension type headaches, but migraine headaches are severe and disabling, and they go see the doctor for them. The question, what is migraine? Migraine is a primary headache disorder with recurrent moderate to severe headaches, which may be one-sided, throbbing, or pulsing, and associated with nausea, vomiting, sensitivity to light or sound. They last 4 to 72 hours. Migraine headaches are worsened by activity, and affected persons want to lie down or sleep. 30% of persons with migraine have an aura, a warning that comes with the headache, which is usually visual, seeing something like stars or half of things or zigzag lines, period. Sometimes the aura comes with small or even no headache. Also, migraine headaches can be generalized. They may be located at the temples, behind the eye on both sides or one side, or sometimes they start in the back of the head on one side and come forward and in the front of the head behind one eye. Migraine is tricky that way. Migraine and tension type headache are 99% of headaches that occur. Tension type headaches are usually mild to moderate in intensity. They're bilateral, which means on both sides of the head, and they occur in the back of the head, neck, and shoulders, or in the jaw. I have related questions. What's the cause of migraine headaches? Migraine is an inherited, genetic, familial kind of thing. For women who have inherited the migraine gene, the reduction in estrogen level, which occurs during the 4th or last week of the cycle, aggravates migraine attacks in 70% of women. It's called menstrual headache. Does migraine start with the first teenage period or for estrogen-sensitive women? The start of menstruation is called menarche, and it may be the first time of an attack of migraine for many women. Do migraine headaches recur? Yeah, migraine is a recurrent neurologic problem. Attacks that come for no reason or with a trigger are related to menstruation for sensitive women. What happens to women with menstrually related migraine during their cycle? Their headaches usually get worse. What happens to estrogen-sensitive migraine women during pregnancy? Migraine for these ladies usually improves during pregnancy, only to return as a monthly recurring event after the baby is born. Does breastfeeding improve or worsen migraine headaches? Breastfeeding usually defers migraine headache attacks. Which is more severe, tension type headache or migraine? Tension type headaches are described as mild to moderate. On a scale of 1 to 10, tension type headaches are less than 5. Migraines are described as moderate to severe headaches, and they're listed as 5 to 10 in severity, and many migraine patients will tell me my headaches are 100 in the office. What's the behavior of people during a migraine attack? Migraine may cause severe, intense, life-limiting headache. Migraine patients put the patient to bed. Migraine headaches are disabling. Persons with tension type headache are usually up and about working, but migraine patients are at home in bed, missing work and missing school. What happens to migraine headaches occurrence with aging? Migraine generally improves after menopause and with aging. What's the duration of a migraine headache attack? According to the International Classification of Headache, version 3, they can last 4 to 72 hours, which is 3 days. So a headache lasting 4 days or 5 days is not a single attack of migraine. What's the difference between episodic and chronic migraine? Chronic migraine is described as 15 headache days a month, 8 of which have migraine features such as being one-sided, severe throbbing, sensitivity to light and sound. Persons with the headaches more than 2 times a week usually have chronic migraine. Episodic headaches are less than 8 headaches per month, or usually less than 2 per week. What's the pain of a headache for migraine like? The pain of migraine headache may be throbbing, pulsing, hot, severe, like a knife, or stabbing, like being hit in the head with a hammer. Are there sexual differences in the occurrence of migraine? Migraine headaches occur in women 3 times more than men. 25% of women have migraine, while 6% of men have migraine. How big a problem are migraine headaches in the world? Migraine is the most frequent medical problem women have. Consider that. More than overweight, hypertension, diabetes, or arthritis. 12% of the world population have migraine. Does migraine have lay names or other names that are used? Migraine has pseudonames, which are false names, such as sinus headache, hungry headache, menstrual headache, nocturnal headache, wake-up headache, barometric pressure headache, weekend or holiday headaches. How does medication overuse headache relate to chronic migraine? Well, the usual cause of chronic migraine is overtreatment with painkillers, narcotics, or over-the-counter drugs. Persons who take aspirin, triptans, non-steroidal inflammatory drugs, Tylenol, opiate narcotics, or barbituric drugs more than 2 days a week are very liable to treat chronic migraine. In general, no migraine patient generally should take opiate narcotics, including tramadol, or any drugs with barbiturate in it. Persons who take aspirin, NSAIDs, caffeine, or Tylenol more than 15 days a month may develop medication overuse headache, but using opiate narcotics, triptans, and barbiturate drugs more than 10 days a month may result in medication overuse headache. What are migraine triggers? Migraine triggers are life issues that set off or kindle migraine headaches. Some migraine triggers are stress, always the number one, freedom from stress, the letdown headache, estrogen drop, which occurs the 3rd week of the normal menstrual cycle, estrogen-based birth control pills or estrogen patches or estrogen intramuscular injections, sleeping too little, sleeping too much, barometric pressure change, dieting or missing meals. I have other blog articles on these subjects on my webpage at www.drmigraine.com. Include articles on triptans, CGRP drugs, Ajovy, Emgality, Aimovig, migraine comorbidities, migraine triggers, Gamagor, migraine treatment, exercise and migraine, CGRP preventive therapy drugs, exercise and migraine, migraine comorbidities, the migraine timing cycle, and acute migraine treatment. So this concludes my talk today on what is migraine. Please click subscribe down there so we can follow each other, and thank you for listening and watching. God bless all you persons who have migraine, and I will see you on the next talk.